Values of Baptist Health, service, honesty, respect, stewardship, and performance are all the Christian values. And so the hospitals, I wouldn't say did not go along that line, but we had pretty strict ways that we wanted things to be run. And that way, if you were in a Baptist hospital in North Little Rock, then those services would be the same quality as you had in Little Rock. And so that's why we went ahead and made it so that we could make the procedures and everything very closely the same in order to be able to manage it as a system. Those values is the only thing that really will make you different, because all of the technical things are provided everywhere else. It's that values of how you provide that service. And the fact that one of the things is that obviously it's nonprofit. And people say, well, it's nonprofit. Well, you have to make money to support the buildings, but there's no shareholders. And so that's what makes it, this sets it apart. Healthcare, as we know, has changed a lot over the years, and you can't survive on your own. We really got the opportunity to get involved in those hospitals, not because they were necessarily making a lot of money, because I'd always say nobody sells a winner. Most people have issues that they need solved, and they're trying to prevent something from being closed. And so that's kind of most of the time what kind of opened up the door. And then we saw the opportunity to leverage the size of Baptist to be able to give them the benefit of operating on a cost-saving basis. And then we had the ability technically to provide the backup support, so they weren't on their own about how to improve things and to be able to put in new systems. People ask you, well, what do you think? Don't you miss it? That's what I always get asked. I said, well, I don't miss the paperwork. I don't miss all of that. I miss the folks, because I was here long enough for a lot of the folks that I hired, had either gotten married or they had families, they grew up, the kids going to college, and some of them had retired. And then that's your memories. That's the favorite memories. I mean, I had, when President Ford was here for the dedication, all of that, I was involved in that. And there's just, all of those openings of hospitals, those are fond memories, but those go away quick. It's those relationships you have with all the folks. As great as the 100 years is, it is wonderful. And we can look back and we can see all of the things that we've done, and we can just, stick our chest out, and that's great, that's wonderful. But the thing that I always get concerned about is that are we going to get complacent and think more about that than we think about what we're going to do in the future? And the fact that we adhere to the values of Baptist Health and preserve those, whether we're running, clinics, or whether we're running retirement villages or any other facility, that we adhere to that and don't give it up.